Dr. Imran, as I was telling you, remember I was telling you earlier? So this is actually a representation of the constant attack our bodies are always going through with all kinds of different viruses, bacteria, germs, and all that, right? And what these antigens are trying to do is to knock down our walls of defenses. So as human beings, right, we have our immune system. And so for the audience, the idea really is to describe to you what's really happening, even in terms of COVID-19 and what's happening with almost on a daily basis with different kinds of diseases attacking our body. So these, they're constantly throwing different uh, rocks at us and different viruses. Now, what happens is that our defenses may be 10,000 soldiers, whereas the enemy has 100,000 soldiers. But what the castles do is they actually protect large amount of enemy soldiers from coming in. And when you have small amounts that can come in at a time, our defenses can knock them out. And not only knock them out, we can actually even capture some of them. And what our defenses do is when we capture the virus, the antigens, we then are able to figure out how do these antigens, how do they communicate? How many do they have? Then we mount our defenses against those. And so then we attack, our bodies attack back, right? Just like is being attacked right now. So the whole idea is that we want to make sure that our bodies are strong and that even though we have less soldiers than the other side, that our defenses are strong enough to withstand uh, these kind of attacks and only let a small amount of people come in or a small amount of enemy soldiers come in. Okay, so that's what's happening now. What happens with co-defenses or comorbidities is that these castle walls begin to be knocked down from the sides, and if they get knocked down, more of the enemy soldiers can come in, allowing causing our immune system or our soldiers to be actually distracted to, and only the 10,000 now can protect 3,000 soldiers here, 3,000 other wall, another wall. That's the problem with comorbidity. So somebody has heart disease, uh, other pre-existing lung disease. They have issues with their immune system. They have diabetes, vascular disease. These are all other walls. If they get attacked, then our immune system has a tough time fighting the viruses. So you can see here, the dragons are now coming in from, trying to attack and trying to break down other defenses of the system. So this is really kind of like a general broad overview of what our body is going through with COVID-19, with any other antigen, and we constantly have to fight this battle. We constantly have to do that. So what's important is that we keep our immune system strong, that we exercise, we don't take on too much stress, and of course it's easier said than done given the COVID environment. That we keep a healthy mind and healthy body. But as we get older, our immune system automatically begins to have less soldiers, so to say, right? So it's harder to defend against these viruses, especially when it's a novel virus, a new attacker like COVID-19. So what's happening is that our elderly have become more vulnerable, as you will show in your slides in your PowerPoint. So that's the idea, is to protect those that are vulnerable, and being elderly puts you in that category automatically because your immune system goes down as we get older. But if somebody has heart disease, somebody, like I said, somebody has vascular disease or diabetes, these are other factors that weaken our immune system. So the number of soldiers we have go down to fight the enemy that's attacking us constantly. So in this case, when COVID attacks and it gets into the lungs, well, if somebody has a weak heart, then it has a difficult time supplying enough blood to keep the oxygenation going. So these are the kind of things that I know you will talk about today. I just want to give the audience a little bit of an idea about, really think about it as a war going on all the time, and that our body is the castle, our soldiers are our immune system, and we just have to perpetually defend ourselves by keeping our immune system strong and preventing less of the soldiers to come in from the outside. That's why the masks are important. That's why cleaning hands all the time is important. Even if you're young, right? There are other issues that can come up, but you want to protect those that you're surrounding with. When you're with your parents or your friends who have other comorbidity factors, you may not get really, really sick badly, but if you do get the virus and you are infected, you may pass it on to somebody who's more vulnerable. So the idea of protecting each other is also very, very strong. I know that again, I want to actually thank Hani and Sephora. Sephora, you have Gabriel's name on your since the game might change it, but so thank you for having us today. I know Cornerstone does this every Sunday, getting your community, our community, our Muslim community, particularly to address different issues or to teach them about different issues that happen. Often from the law perspective, since both of you are lawyers, but today you wanted to talk medicine, and so we wanted to talk COVID. So I brought a very good panel. Sephora, if you want to actually kind of do the introduction into yourself and Annie, and then tell us a little bit about Cornerstone, and then we'll.
I wanted to thank you, Dr. Sana, for coordinating this with Dr. Imran and Dr. Taliha, and thank you all to take the time to have your busy schedule. We can see that Dr. Imran is working today, actually. So may Allah reward you very well for doing this.
Yeah.
Thank you.
Yeah, assalamu alaikum, and welcome all of you and all the attendees. And so this is our 5th installment. We're doing a series of Zoominars where Cornerstone Law Services is providing legal and financial tools for Muslim families. And it's our way of making legal and financial tools understandable and accessible to all of you. So we will be bringing in experts in many fields relative to our unique situations, and this will allow you all an opportunity to learn from and ask questions from people who have extensive knowledge in areas that are important to you. And then today, this morning, we have 3 amazing doctors from our own community, Southern California community. We have Dr. Sana Khan, radiologist, Dr. Imran Sharif. He's presented COVID on many national TV programs, and he's a pulmonologist. And we have Dr. Taliha Yassin, and she is an up-and-coming star in the medical community. She's an infectious disease fellow at UCI, and we're really lucky to have them here this week. And so please post any questions you have in the Q&A section below, or email us at info@cornerstonelawservices.com, and we'll respond with the answers. And make sure to check out our website, cornerstonelawservices.com. And as usual, I would just like to emphasize that the purpose of these webinars are for educational purposes and not intended to be medical or legal advice. And please contact a professional to develop a proper plan that's right for your personal situation. And with that, I'll have you guys start presenting your information. We'll start with Dr. Imran.
Excellent. Dr. Imran, I'm going to control your slides. I know you're at work and on your phone, so but you have the view of it. So let me know whenever you want me to go to the next slide. And inshallah, bismillah, let's start.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone. First of all, I want to thank you for the invitation. I want to thank Corner Law Firm, Sephora Khan, Hani, and I want to thank Dr. Sana Khan for inviting me. And I think this is a very important topic. As you all know, we are all facing it. Somehow we are all related or linked one way or another, whether it's a friend or a family in US or abroad or in a different country, which has contacted COVID. And sometimes you have good outcome, and sometimes you have heard stories where the outcome has not been good. And I'll just give you an example. I was talking to one of my close friends for last 4 or 5 days, a well-known person in Karachi, got COVID-19, got into the doctor's hospital, got intubated, and we've been working on the care. But unfortunately, the virus is so strong that we were not able to save him. Obviously, I mean, I've been communicating through telemedicine, and people on ground were trying to manage him. So just to give you a little background. So this is something which is really important for all of us. And I'm going to talk in a way that if a layman is understanding, they can understand. And if a healthcare professional is watching, they can understand. So I will use terminologies in a way they both can understand, or I may have to specify that this particular area is only for the healthcare professional because that is a very specialized area. So just to get started, this virus has been in existence for ages, and this virus have been noted in humans, also in bats, camels, cattle, cats, and in the past, the same family of viruses, which are called coronaviruses, have caused major issues in the world, which were SARS and MERS. You've heard about it. And the reason we call them coronaviruses or COVID-19 because of the appearance of the virus, it is covered like a crown or cones, and that's why it's called coronavirus or COVID-19 or SARS-CoV-2. So this virus has been in existence for a long time, and it usually stays mostly in animals, and humans get it by doing exotic activities, as we have heard. So as you can see from the first slide, the virus has spikes on its surface, and these spikes help you get into the human body. And the initial carrier is bats or pangolin, and from there through zoonosis it gets into the human body, and once it gets into the human body, then the process will start. So you can get the virus by someone coughing, sneezing, or even if you have the virus somewhere on the surface of a wood, metal, steel, and you touch it, and you touch your fingers, say in your conjunctiva, or any like oral cavity or nasal cavity, the virus can get into your system. Next slide, please. Next slide.
I'm trying. I'm looking for trying to get a raise from you so I can be. I'm kind of expensive, Dr. Imran.
Okay, but thank you, Sanabai, for your services.
And yeah, and this is not like my normal job, just so you know. Is this good? Is this the slide? Yeah.
This is the slide. Yeah. Thank
Okay.
you. So let's try to understand exactly what is the impact of this pandemic on us. This slide is I updated a few days ago, so it's not from last night. So on Tuesday, the global cases were 38,040,063 cases, and the recovered were 28,598,73 cases. Global death more than 1 million. United States cases are over 8 million. Deaths, unfortunately, is 220,000 plus, and the recovered cases is over 5 million. And this is just to give you an example of the numbers of this pandemic, which started and we got involved in March, but obviously this was already in China and other part of the world, but traveling towards us. So just to have you understand what these numbers mean. If you look at the bottom right-hand corner, influenza, as we all aware, we all get it, and one way or another. So in general, you get in a year, a fiscal year, which is 2018, 2019, 35 million cases of flu, 16.5 million medical visits, 490,000 hospitalization, 34,000 deaths. Now look at these numbers and compare with COVID. COVID is very significantly dangerous, harmful to the human kind. So
those that say that this is like a flu, I mean, it's not really.
It's not.
Yeah, I mean, that's just a terrible comparison giving these numbers.
Yes, I mean, you can't compare this with flu. Flu is actually, most cases of flu are very mild, and usually people who have comorbid illness or extremely elderly, they get into trouble. Even if they get into trouble, we can get them out of trouble. But COVID-19, as I'll share with you the data while in next 20 minutes, you will understand it's not the same. So next slide, please.
Yeah, I think when it first came out, even in our medical community, we were thinking this is going to be like the flu. But as we've learned more information about it and just seen what it does to patients, that concept is totally gone now.
I completely agree. So this is just to give you an example of a graph. And if you look at the graph on the left-hand side, and as you can see in March and onward. I think I got this graph captured on October. I can't see the date clearly, but it's middle of October. And as you can see, the number of cases just continue to rise very steadily. And if you look at the graph on the right-hand side, the blue is United States, and you can see the number of cases continue to rise very steadily. While the middle graph is for Asia. So initially, the cases in Asian continent were lower, and as the time passes, they're steadily increasing. Europe is somewhat steady, but we'll talk about the second wave as we move forward in the talk, and we'll share with you some information about what's happening in Spain, UK, and other parts of the Europe. Next slide, please.
So just one second, Henny and Gabe, I'm getting a lot of texts saying that they have registered, but they don't have a link to join.
Okay, that's weird because they have to. They should get it right away. Let me. What I'll do is I'll send an email right now.
Okay. You want to send me an email so I can forward the links to people?
Yeah, absolutely. Okay, sounds good.
Okay. Yeah, because I'm just getting buzzed to death here. Okay, is this the slide you want to be on?
Yes, thank you, Sana.
Okay.
Dr. Sana. So this is just to give you a comparison and understanding of what is COVID-19 doing to us. And if you look at this graph, at the bottom, you can see flu cases and what are the numbers and where do they stand. And then if you go further up, you've got Asian flu, then you go up flu with pneumonia. And if you go further up, it's cancer and then heart disease. As you can see, during the peak time of COVID-19, there were more casualties with COVID-19 than heart disease. And heart disease is the leading issue in the US and all around the globe. Obviously, cancer is there also. So, this is a very significant issue for all of us and a serious problem. Next slide. Now, this is this graph on the right-hand side is the linear representation, and the left is the plot form. As you can see on the right-hand side, this is dated October. Sanabai, can you read the date? It's I can't see it clearly.
October 9th.
October 9th. So I picked up this linear representation on October 9th, and you can see more than 1 million deaths, unfortunately. Left-hand side, you can see the blue graph showing the number of deaths continue to persistently be there and increase, while Europe has a spike and it's slows down, and now the number of deaths are increasing in Asia too. So it's steadily, slowly causing more casualties as the time passes. And as we move forward, we'll have much more understanding why is that happening. Next slide, please.
How am I doing so far? Pretty good?
Pretty good, yeah.
Okay, good.
So this is a comparison of Spanish flu, as every one of us here. I'm not sure many survivors are still there in the world, but Spanish flu 1918 and then seasonal flu and COVID-19. So this is a little bit of an older slide for COVID-19, but this is just to give you an example. Estimated mortality rate is 10 to 20% with Spanish flu, which is extremely, extremely high. And obviously at that time, 1918, we don't have those resources. We don't have that knowledge base. We don't have all the tools which are available now. Seasonal flu, 0.1%. So you can see the mortality from seasonal flu is not much. And as compared to COVID-19, the mortality is running between 3.5 to 4% from the get-go, which is a very, very, very high number, and it's very steady. Next slide, please.
So this is really a 3,000, almost 4,000% higher mortality rate.
Yes.
Right. If you really compare that in terms of percentage, it's 3,720% higher death rate. Like the numbers really stand out significantly when you put them in that kind of a comparison, right?
Yes. So I completely agree. So next slide, please. So what are the things that we get concerned when we see, say, for example, you come to the emergency room, and what are the things that we will be looking for, and what will make us concerned about you? with your symptoms of fever, cough, shortness of breath. If you're older, which is if your age is greater than 65, if you're male, obesity means this is just not published in the medical literature. It is every day since I've been seeing these COVID cases in different counties, in different hospitals, which is Orange County, LA County, and Inland Empire. 95% plus are morbidly obese. So that is a huge risk factor that we see it every single day, even if they don't have other risk factors not present. Then we see a lot of cases of COVID-19 minority, and it's unfortunate, but Hispanics and African American are significantly impacted. Nursing home has created itself as a risk factor. So there are a lot of issues happening in nursing home, and I have a slide at the end which share with you the numbers, but there have been a lot of hotspots in Los Angeles County. Multiple nursing homes have outbreaks, and there are reasons because of not providing what we call isolation for infected COVID-19 cases, proper COVID-19 isolation, which does impact and also properly not teaching the staff what are the measures they have to do, and also not availability of enough personal protective equipment. So that's how these things got started in March. Now, obviously, things are getting better with knowledge base and also availability of a lot of help and support from the government and also from the community. As you see, diabetes is another huge risk factor, high blood pressure, pulmonary and cardiac disease, as Dr. Sana mentioned earlier. And I would just say this, that Dr. Sanahan was very thoughtful the way he presented the video, a good representation how our body respond to this virus, and why Dr. Sanahan presented that video. You will find out in next few slides, and you will know that actually COVID-19 works very similar to the way that video was presented. Next slide, please. So what are the common symptoms? So these are some of the common symptoms. Obviously, you can read, but fever, cough, shortness of breath, body ache, and there are like a lot of these symptoms, but the most common symptoms which you need to look at is, if you go to next slide, Dr. Sana. So chills, loss of smell, vomiting, rash, then muscle ache, loss of taste. So these are some of the most common and prominent symptoms that you will have when you develop COVID-19.
So rashes? I wasn't aware of that. And then toes, COVID toes. I'm sorry, what does that mean?
Basically, it's just having similar kind of rash in the lower part of your foot, involving the digits. So these are some of the prominent symptoms that you will feel or you will see if you're a physician, and if you're a patient, then you'll have some of these. Next slide. So what happened once you get exposed to, as we talked about, means you can get the infection by if someone is coughing, sneezing, or touching an infected area where the virus was already there. So once you get exposed, day 5, first 5 days are very important, because that time you don't know if you have an infection, you're healthy, you're walking around, and that's the time that you can spread the virus to others. And you're very highly contagious. And then you have a presentation of your first symptom on day 5. You present to the emergency room at that time, or on day 10 when you have dyspnea. And around that time frame, you are in trouble, because when you develop dyspnea, that's the time that you need to be admitted to the hospital. And after that, it all depends on the course of the disease and how fast you get the treatment and how soon you get admitted, how fast, how much quickly you're able to get the oxygen that your body needs. And that all will determine what will be your outcome. So next slide. So this is a really complicated slide, which for a layman, I don't expect that they will understand the slide, but just think of it that because of COVID-19 infection, you get a lot of mediators released because of a lot of fighting going on, what Dr. Sana showed in the video, and those things which fight for you is neutrophil, and they're actively recruited by multiple other mediators, and that causes cascade of events, which could be forming clots, coagulation, inflammation, fibrinolysis. These are all medical terms. But what happened because of all these activities in your system, there's a damage to the endothelium, and you have vessels which are protecting you. But when there's a break or there's a damage to this endothelium, it causes leakage of the virus getting into your system. Once the virus gets into your system through the bloodstream, then it can reach any part of the body. So then you are in huge trouble. So we need to act at a point where we can stop this stage or prevent this from progressing further. Because once the virus gets into your system, then it is very hard to stop the virus causing the damage. Next slide, please.
Talia, sometimes you talk about the cytokine storm.
Mhm.
We hear that often. What does that mean?
So that's usually an inflammatory response that your body produces to having the virus. It doesn't come immediately. It usually takes time, and it's different in different patients. And that's why you see some patients with coronavirus that are intubated and fighting for their life, and others that are so mild. So that has a big role in why you see that. So the cytokine response, it's pretty complicated to explain, but in simple terms, it's basically kind of like the video you first showed. Like all your body's defenses are all out, trying to fight, and they're kind of in overdrive, and that's some of the basis of some of the medications we use. For example, steroids, they're recommended later on in the disease course, and that's kind of why, because they'll help decrease that inflammatory response.
So sometimes your own response, in fact, can become a problem.
It can. That depends on everyone's individual immunity. Yeah, it's
then
very.
Are those the symptoms that, I mean, it takes time for the cytokine response to take place? So is that why there's like a non-symptomatic phase in the beginning?
So initially you just have the viral load and your body's own response to fighting that virus, and it kind of takes time for that, and then it kind of takes time for your immune system to respond, and that's why you see that everyone's immune system is so different, and that's why they respond differently. And these are some of the things you can see over the long term with it. Yeah.
What can we do, Dr. Imran, for our immune system to make our immune system better so we can fight this better? Because there's a lot of people that actually never even know that they got the virus, right? They get exposed to it, but their immune system will essentially knock it out. Because so does it have to with, you talk about viral load, Talia? Is that how much virus comes in, or how much we get exposed to it?
Yeah, that's the initial inoculum. Like, let's say if someone was not wearing a mask and they were to cough on you, and let's say that you had they were carrying a high viral load, or basically amount of virus, you would tend to get sicker versus if they were wearing a mask, you were wearing a mask, and they had COVID. Maybe you got some amount, but we also think the masks that's the other second role of masks, that they don't just protect you from the virus, but they also give you less exposure to it if in case you were to get sick from it. So maybe you have a milder disease form.
Right.
Yeah.
So also what I find interesting is that when I wear the mask, I tend to be more conscientious about touching my nose or my mouth, right? So a lot of times we're also the transporters of the virus to ourselves because of just touching the surfaces or where it may be, and then touching ourselves. So maybe it sounds to me like maybe the masks help not only from somebody else giving it to us, but maybe ourselves even.
Yeah, they definitely protect against cross-contamination. I agree with that.
The data is pretty clear on that, right? So
yes. I think probably I will just answer a few of the things. First of all, Safura asked about cytokine response. So once you are into that stage, that means the virus is pretty aggressive, and now you need to be treated. Whether you need to be admitted to the hospital, you need to be on oxygen. So at that time, you're in trouble with when the cytokine storm is happening. So we need to stop that cytokine storm. So we'll talk about that more about in the treatment. And regarding the viruses, I think the mask is very helpful. And just to mention a few things, one is this virus can live on surfaces, which is metal, wood, plastic for 72 hours. But there's a recent study from Australia published a few days ago where they kept the virus in the dark area. And according to them, the virus lived for 21 days.
Wow.
That's the Australian study. And I think there were a lot of criticism about the study because we don't want to create too much scare in the population, in the general public, that the virus can live for 21 days. Then it's going to be a real nightmare to manage this virus. I mean, you just keep cleaning and cleaning and cleaning. So, but at least 72 hours and get a good sunlight exposure means how to get your immune system well. One is good sleep. 8 hours of sleep time is recommended by American Academy of Sleep Medicine. Eating well, which is a high protein diet, and keep yourself hydrated. And getting supplement may or may not, as long as you're eating healthy, you don't need supplement. But if you're not eating healthy, then supplement will help. And exercise, outdoor activities, all those things will help you boost up your immune system.
Actually, fasting, right? Maybe you can. Fasting helps your immune system.
Fasting helps your immune system. Yes, that's true. And I think it is a very interesting trend in the Western world that people now are fasting either 24 hours or 18 hours or longer or shorter. Or I have friends who fast with me during Ramadan. They fast the whole month, the same way as we do. So it is very common.
I have a Jewish friend that fasts every Monday. Every Monday he fasts.
Every Monday, yes.
Yeah, and he's Jewish. I was like, wow, that's a sunnah of the Prophet. I mean, really.
Yeah, that's true. Yeah.
Okay, so let's
forward.
I have one more quick question regarding the because the reason I was asking about the symptoms was, we were recommended to get an oximeter and check, if your oxygen levels are lower, but like you're not really having any symptoms, but you're just checking on. So I was wondering if that's something also to consider.
Yeah. So I had. Sorry, go ahead.
So basically, you don't need to check your oxygen level if you're not having any symptoms. It's just basically not going to add anything. But yes, if you are symptomatic, then you should be checking your oxygen level, because at that time we need to decide whether we need to put you on oxygen, we need to admit you to the hospital, we need to start you on treatment. The whole treatment for COVID-19 depends a lot on the oxygen need and oxygen requirement, and it changes drastically. And your outcome also depends on your oxygen requirement, your ventilator requirement, and how long you have been on. Go ahead, Talia.
Oh, I was just going to say I think it's the World Health Organization criteria for admission is oxygen less than 90%, even if you're asymptomatic. But I agree, if you're not having any symptoms, there's no need to check it.
So let's move forward to this next slide. So basically, COVID-19 causes the same slide, the previous one.
I'll go.
So COVID-19 causes multi-system dysfunction. So it can impact pretty much most of your major systems that we know of. The most important, it is a lung disease. So it causes a lot of changes in the lungs for the physicians and for healthcare professionals. As you can see, it can cause the change of the membrane or hyaline membrane, extensive edema, which is fluid accumulation, small clot formation, and then inflammatory infiltrate, and then later on fibrosis down the road. But for laymen, it causes significant damage to the lungs. So that way, oxygenation and carbon dioxide removal get significantly impacted. And because of so much damage to the lung and change in the hyaline membrane, we always have a very difficult time in oxygenating,
Mm.
giving the oxygen into the system, and also getting the CO2 out of the system. And especially in the complicated cases who are on the ventilator, we have a very difficult time doing both maneuver, and both maneuvers are crucial for us to keep you alive. So that's one organ which is significantly damaged and the most important, most crucial organ in this disease. Then the other thing that we have seen patients present with COVID-19 and stroke, and there are things which can impact. Kidneys get impacted significantly, which is acute kidney injury or focal necrosis or vasculitis. So kidneys can get damaged. And if you know of someone in the hospital, you may have heard that they have COVID-19, they end up getting on dialysis, which is a very common thing that we see in the ICU. And heart get impacted. Patients with COVID-19, they are at risk for having a heart attack. Gallbladder get impacted. GI tract get impacted. So this is a multi-system disease. And so we have to understand it, and we have to react and act and treat it as soon as possible. Next slide, please.
Does it cause inflammation of the blood vessels?
Yes.
Right.
And
So,
then
and that means it's your entire body is going to be affected potentially.
entire body is going to be affected.
Yeah.
Yes, that's true.
Mm.
That's very accurate. So this is just to give you an example. How does the pathology look like? And as if any audience is a pathologist, they know all
Yeah,
the
Dr.
changes.
Yasmin is on. She's watching. She's a pathologist.
Yeah.
You better
So,
be right about this. She's gonna
yeah.
get you. Okay.
Yeah. So what I was trying to say is for layman, they won't understand, but for healthcare profession, this is usually the pathology usually looks like, which is different stages of disease process, which is edema, organizing pneumonia, fibrosis, and release of inflammatory mediator. So obviously this is a different lecture. So this is just to give you an idea how does the organs or lungs look like when they get impacted. Next slide, please. So I mean, we always talk about COVID-19 in adults, but this area has not been looked into in detail, which is COVID-19 impacting kids. Now, initially when the disease came, everyone was saying the kids are protected, they have no issue, and we don't have to worry about it, but that's not the case. COVID-19 can cause a disease which is very similar to vasculitis or inflammation of the vessel, as Dr. Sana Khan mentioned, or we call it Kawasaki disease. And it's called multi-system inflammatory systemic disease. And they have certain features to qualify to call this particular name or this disease, which is fever, rash, signs of positive cultures, or COVID-19 SARS-CoV-2 positivity. So all these criteria needs to fulfill, and the kids can get infected. So it's a myth that kids are not are protected and they cannot get infected. And there are reported deaths in children. So almost a month ago, I looked at the data. That's more than 70 deaths in children. So we have to still take care of the kids, especially with the schools opening in Orange County and restriction hybrid model. So we need to protect our kids. They have to go to school with the mask, and we need to educate our kids about COVID-19 disease. Like I will give example of my own children. They don't leave the house without the mask. When they come home, we usually hug them and kiss them, but they're so protective. They don't come close to me. They said, okay, Baba, wait. They go, they wash themselves, they change, and then they come, hug me, kiss me. And obviously I do the same thing. So I'm just trying to help people understand that this is something that you have to do routinely for now. Down the road, we'll see how things will turn out.
Especially when you're visiting the parents and stuff, because every time I visit my parents, before I do anything, I actually go and wash my hands for the 20 to 30 seconds with soap, just so that whatever I'm bringing in from the outside, potentially, at least I'm washing that off, and try to maybe sit as much away as I can also. So it's very important because my parents are in the 70s and even my dad's in the early 80s now. So it's critical to be protective of them as well as yourself.
That's yes, excellent point. Next slide, please. So what can you guys do out there in the community? And this is called W's. Wash your hand, as Dr. Sana mentioned, very important. I mean, 20 seconds, wash it well. Wear a mask, as Talia and Dr. Sana Khan has mentioned. Mask will protect you and protect others. If you are in the initial 5 days of COVID-19 infection, you are shedding the virus and you can distribute it to your loved ones, friends, family, elderly, kids. 100, 200 people. So wear a mask, whether you have the infection or you don't. And then social distancing, obviously, that is important, as Dr. Sana mentioned, 6 feet apart or further. So these are the few things that you have to do. And obviously, cleanliness. Say, for example, you are not working from home, you go to an office, you clean as soon as you enter the door, clean your doorknobs, clean your desk, computer, laptop, where you sit, your desk, your chairs, and do that on a daily basis. As I mentioned again and again, that the virus can live at least 72 hours, and according to some studies, if the area is dark, 21 days. So the virus can live long. So it is important that you clean wherever you go and work every day. Next slide. So what do we do, and how to address these issues? So these are just some of the treatment which have been tried, which have been used. Some are successful, some are not. And I will share with you the data about Decadron, which is called dexamethasone, or it is steroids. That's the most successful medication. And it was, the study was done in UK, NHS, and a very successful trial. Rest of the studies, Lovenox, there have been some autopsy study. Autopsy means that when the person dies, we look into their organs by surgically operating, and they found clots. So that was the whole thought process. But I have not seen any improvement with blood thinner or Lovenox or any form of heparin. Neither it has been reported in the literature. Remdesivir, this was the medication which was approved, and Gillette is the company. So it basically decreases the duration of your illness from 15 to 11 days, so 4 days reduction. But there was 2 recent studies, not published, data is not available, but it was reported in the media that remdesivir was not effective, and Gillette is challenging that document or comment. As I said, the study is not published, the study data is not available. So two studies, one is solidarity trial, and there's another trial with remdesivir. The next drug online is the next medication, the next treatment is plasma. Not the same side, Dr. Sana. So plasma has been used with the thought process that someone, say, get infected, they developed antibodies, and if you extract that antibody and inject into someone who's infected, that can take care of the problem. But that's not the case. All the studies have been negative, and my personal experience, and I have taken care of, I can say, at least few thousand COVID-19 cases. I have not seen any significant benefit from plasma infusion, neither any of the studies. Then lopinavir, which is an HIV medication, all the trials have been negative. Actemra, as Dr. Talia mentioned about cytokine storm. So this is the drug which worked on the cytokine storm, and initially it was being used pretty significantly. Still, we're using it, and I have seen cases where it has been effective, and there are reported cases and published studies where it has been effective, but it's not the frontline drug yet. But the concept of cytokine storm and using this before that happened, that may be very effective. Then the magic drug or magic medication, or whatever you call the monoclonal antibody that our president used, It is experimental. There's no data available, and it was just used in the trial. So it was used in President Trump. So that's why there's so much know-how about this drug. But otherwise, I can't recommend and I can't say against it. So it is just an experimental treatment at this time. So next slide, please.
No. There.
So Dr. Sana, if you can point out to the first graph, I mean, even for for the community and person who are not in the healthcare profession, you can see the two graph on the left-hand side top graph, which is among all participants, the black one and the red one. As you can see, the difference, that difference tells me and tells the people who are analyzing this data that the bottom part did better than the top part. And we call it, we use the p-value, which is on the left-hand side, p-value of 0.001. And then if you go on the right-hand side, this is the patient who were on the ventilator, and you see the difference between the two graphs. And it's a huge improvement in person who end up in ICU, who goes on the ventilator. And if you start the drug on the right time, it does make a difference. It does make a difference. So the usual treatment of this drug is 6 milligram IV medication of Decadron for 10 days. So we have to start it at the right time. So that is the magic number when to start it. And if you go into the left-hand side, person who are on oxygen, you see the difference as we discussed, and as Safura also asked about the pulse ox or oxygen testing. So if someone is symptomatic and if you test their oxygen level and if it's less than 90%, yeah, they're in trouble. They need to be on oxygen. They need to be started on this medication. And if you remember, our president had twice drop in oxygen level before their doctor decided to start him on Decadron. The right-hand lower part, people who don't need oxygen, this drug is harmful. So if you go to your primary care physician, you talk to them and you're COVID-19 positive, or you're talking to them on the phone, and if you request them steroids, and you're not on oxygen, it's actually going to hurt you. So try not to do that. So follow your doctor's advice, but this is the drug which has shown benefit out of everything else. And let's go to the next slide. So I think this is our president, right? And
You think? With the mask on, I couldn't tell.
And I think he has the mask on, he has not the mask off. And you can see on the right-hand bottom part, he has a team of doctors. Do you think we have a team of doctors? Or you get sick, you have a team of 8 physicians right there taking care of you from get-go? That doesn't happen. So the president outcome was so well because he has a team of physicians, everyone is looking after him, and they're looking at every single symptom that he goes through. Short of breath, cough, drop in oxygen level, they react immediately. And that doesn't happen in the real world. So our president received Decadron because his oxygen level was low. Our president received remdesivir, which has shown improvement in the duration of illness, and he received monoclonal antibody. Monoclonal antibody is manufactured in the lab, and there are 2 companies which are working on it, Lilly and Regeneron. And what they do is they manufacture these artificial antibodies. And the thought process is these 2 antibodies in that infusion goes against the virus, block the COVID-19 spikes or the virus, and prevent it from entering into your system. If you remember, we talked about damage to the vessel wall and then the virus getting into your system. So this will go and block it. And this was the whole thought process for our president, and God bless him. And I'm very happy that he did well with the treatment, and hopefully it will work for other people also. Next slide. So this is just a schematic of different maneuvers that we do for the patient in the ICU on the ventilator and what we do usually. On the left-hand side, what are the diagnostic tests that usually you need to do, which is include ferritin, D-dimer, CRP, and as you see the list. And most of the healthcare professionals are familiar, or they can use this slide as a reference point. And once these patients run into trouble and get onto the ventilator, then what we call lung protective ventilation, which is there are certain changes which help you prevent a lot of release of inflammatory mediator. So we have to handle the lungs very delicately. So we usually give them tidal volume, which is 4 to 6 ml per kg tidal volume, and we give them high amount of PEEP. So these are all medical terminology. I don't think I don't think I can explain it to the community, but these are certain measures that the doctors and other healthcare professionals needs to understand and learn. And other than low tidal volume, high PEEP, the measures which are helpful is proning, which people can do at home. We do it for patients who are not on the ventilator, who are on a regular ward. We ask them to sleep on their belly. It helps recruitment and help in distributing oxygen uniformly along the lung, because your lung is so damaged. So we need to use gravity and get the impacted area down, and rest of the lungs have oxygen distributed homogeneously. Otherwise, if the prone positioning, tidal volume, 4-6 ml, high PEEP, and other measures don't work, then we go into a lung heart machine, which is called ECMO, and that's the last resort. And usually ECMO machines are available at specialized centers, like example UCLA, Cedars-Sinai, and UC San Diego. These are just examples. Not every hospital have it. So for this, you have to be airlifted and go to a specialized center. So let me go to the next slide.
Trying. All right. There we go. Wow.
So before, I think this is probably, I have the best expert with us, Dr. Sana Khan, I think one of the best radiologists in Southern California. So I think he can actually go over this radiologic imaging much better than me. I can point out the middle X-ray just for reference point is a normal X-ray. This is your lungs should look like. Look at the right hand top corner and the left hand. These are the damaged lungs because of COVID-19, because of inflammation, pneumonia, and ARDS. And the bottom right and left is CAT scan with the changes which are suggestive of pneumonia. And I think probably I will have input from Dr. Sana Khan about this.
And are these long-term, or do they initially?
That's an excellent question. Now, the thing is, all the patients who have been infected from March, April, May, June, so we are following them. And most of them are still having issues with oxygenation and rehabilitation. So we don't know how long this impact is going to last. My best guess is, yes, they're going to be long-term. People who end up getting on the ventilator, who end up going into ICU, I think their lungs are going to be impacted for significant duration. There's a term we call pulmonary fibrosis. I think some of them may develop pulmonary fibrosis, and ARDS complication can happen, which is also a lung disease because of high oxygen requirement and high PEEP requirement. So Dr. Sana, please comment.
No, I mean, that's exactly right. Without making it too complicated for you guys, but you get this ground glass appearance. You basically have this infiltration that goes all throughout the lung, and inflammation is, again, it's a war going on, right? So that's why it can actually cause what's called fibrosis, which is basically scarring of the lung. I think that a lot of it depends on the duration of the disease and how long that war is happening. So for most people that get the virus, get infected, they actually are going to be okay from the perspective that since they're not going to be, many people are not going to be symptomatic at all, the body takes care of it and it goes away, then you're really not going to have long-term consequences. But those that actually have the disease, that actually have longer battle, there is going to be some, collateral damage, right? Which is then essentially scarring of the lung tissue, depending on how long the battle goes on. Dr. Imran and Dr. Talia probably seen this kind of image on the, patients in the ICU and whatnot. And it's really sad at that point in time, because even if they come out and survive, they're still going to potentially really have long-term consequences of shortness of breath and things like that.
Yeah, I mean, I think these are excellent points, Dr. Sana. Most of the patients are going to recover well, so that's good news. But patients who end up in the ICU, patients who end up on the ventilator, yes, they're going to be in trouble. And my best guess is we don't have this data yet, because we're learning about the disease and we still need more time. These patients are going to have long-term disability, which could be whether they'll be oxygen dependent, or they'll need a lot of rehab, or they'll end up in the nursing home, or they'll get a tracheostomy, which is making a hole in their neck and connecting with the ventilator or the machine. So long-term consequences, we should know probably sometime next year, and we'll have more information. So stay tuned. Next slide.
Yeah, they also had a question about long-term implications of COVID, and someone was talking about neurologic defects, including strokes. So I think that's one of the many consequences, and I've seen a lot of patients with renal failure too as another consequence. Yeah,
and interestingly enough, because the patients who are in ICU on the ventilator, this is a very average patient in ICU, that their oxygen requirement is between 90 to 100%. Their PEEP is between 12 to 18, and we cannot oxygenate them. And somehow after a few weeks, these patients get a little better. And once we start cutting down their sedation, they don't wake up. So this hypoxemia is causing significant neurologic damage. And we are seeing that pretty much every day, every week. So whether these are mini strokes or these are hypoxic injuries to the brain cells, or both. So yes, it's a good point, Taria. Thank you. So on this slide, left-hand side is basically I'm trying to share what is this ARDS NET protocol is. It's mostly for the healthcare professional, and there are two methods of managing with ARDS NET protocol. Is the low PEEP and high PEEP, and basically you just need to follow these tables. You don't have to memorize it. And what I usually suggest is just to make a copy of this slide, laminate it, and stick it on your ventilator and adjust your ventilator accordingly, because this has shown to be beneficial in patients with ARDS, and COVID-19 causes ARDS. And also one other thing that I want to bring up as I mentioned is keep these patients on the dry side or negative. So don't give them a lot of fluid. Try to keep them as negative as possible. That helps us taking them off the ventilator, and that will help you take these patients off the ventilator if you keep them on the negative side. Right side picture is a picture of a lung heart machine or ECMO, where your blood is removed either from the neck or the groin, goes to the machine, which is the lung heart machine, and get oxygenated. We inject oxygen, and then the blood will go back in your system. So this is an artificial method of keeping you alive, and ECMO has been used in other scenarios, but now we are using it in this case because in patients with COVID-19, the lungs are so damaged, we just cannot oxygenate them. This means we see it, and interestingly, their carbon dioxide level just continues to rise. Whatever changes we make on the ventilator, we just cannot get rid of the CO2. So this is something that you need on and off with this disease. Next slide, please.
Yeah, so it's a really important point also, right? We talk about ventilators and trying to keep people alive and all that. And Hani, maybe after we get done, you can talk a little bit about advanced healthcare directives, so that the doctors know what is it that you wish the patient wishes for, right? And how much effort should be done to keep the patient alive artificially. That's all part of the advanced healthcare directives. So if you can take a few minutes after we get done to talk about it a little bit, that would be helpful. Thank you.
Yeah, I think that's a good point, Dr. Sana, because in ICU, average stay is between 3 to 5 weeks, and staying on the ventilator for 3 to 5 weeks, your prognosis is not that great. And I think we have to have these advanced directive or further life care decisions earlier, rather than keeping someone, their wishes were not to be kept alive with artificial means for so long. And plus, even if you survive, the quality of life is not going to be there. You're going to have a tracheostomy, a feeding tube, and you'll go to a nursing home. And if the person wishes is not to be kept alive on the machine, then we should terminate and let them go peacefully and respect them. So I think I completely agree. Next slide, please.
I'm trying there.
So this is about the vaccine. There are almost 200 pharmaceutical companies in hunt for a vaccine. And the major ones are Johnson & Johnson, Eli Lilly, and a few others, which are in phase 3 trial. As we all know, there are phase 1, phase 2, and phase 3. And phase 3 is the last trial. And during this trial, we try to enroll as many people, as many subjects as we can, and the sample size should be as diverse as possible. So one of the companies have issues in September. I think it was Eli Lilly. So they had one case with the transverse myelitis. They stopped it, resumed it. Johnson & Johnson have some issues with their trial. They are planning to enroll 60,000 subject, very diverse group, North America, South America, Africa, Asia. So very good sample, but they have some issues also. So they held it, restarted. So this process is in phase 3, which is good news. It's going to take a little bit of time. And I think we should have the vaccine hopefully within next, say, between 2 to 6 months. And I think these companies are working very hard, and these pharmaceutical companies work on multiple prototypes of the vaccine. So if one sample doesn't work, then they have the other sample working. So I'm very hopeful with the technology and the resources that we have available, the vaccine will be available soon. The challenge that we're going to have is how to deliver it. We have a huge population. It's not me, Dr. Sana, or rest of the group member. It is going to be everyone in the world needing this vaccine. So you're talking about 7+ billion samples of vaccine, mass production, and that's going to be another challenge. So we'll have to prioritize. We have to find places where we can deliver or go deliver, and then we need to do it in phases. There'll be phase 1, phase 2, phase 3, and then at some point the whole world will have the vaccine. So next slide. So this is something I think which is very relevant for I think Hani and Safura. I think if probably you should, even if you want to take notes or if you want to keep these slides, this is what happened in these patients who comes to ICU. There's a lot of information there, but the pertinent information is the mortality and length of stay is extremely prolonged. That's, I would say, weeks or months in ICU. According to one study, 41%. Then you can see the second study, which is close to 50% in March and then 40% end of May. And the third, as you can see, mortality rate of patient with COVID-19 in intensive care unit, systemic review, United States 23%, Italy 25%, China 37%, and global 25%. So these are just examples from few studies that the outcome of patients coming to ICU is going to be prolonged and worse. Next slide.
And the thing is that also with the healthcare directive, I mean, they don't allow family members or friends or anyone to come into the, ICU and advise you at that time.
Yeah, so we just happened, something happened last night. I was telling you about earlier. We had one of our Fajr, regular Fajr person who attends Fajr regularly in Masjid, had a stroke last night. And he's in the hospital, and the hospital he's at is preventing, visitors. So trying to do a healthcare directive at that time, obviously, or during this kind of a crisis, is probably very, very hard to do, especially if you can't even visit and talk to the person about anything, right? So,
Mhm.
yeah,
Yeah.
very important to get this done.
Yeah, I think it's very important. Yes. So this slide, uh, there are different study and published data that I'm sharing. According to one study, 61% patient disease by 60 days after ICU admission. So 60 days, that's 2 months. So these patients stayed in ICU, and risk factor, as you can see, 65 years of age, ARDS, acute kidney injury. And then according to German study, 72% mortality if it comes to ICU. And another study done in New York, mortality is between 76 to 97%. So I think for you guys, Safura and Hani, if the person with COVID-19 is in the hospital, even if they have not made an advance directive, I think that may be a good time to discuss about their advance directive. Say someone comes to the emergency room, get admitted to a hospital ward, I think that's a good time to talk about their advance directive, not to wait till they come to ICU. Once they comes to ICU, then you are now dependent on the families, what they're going to decide and what their wishes is. They're just going to become up what the patient may have wanted. But so this may be of little help for you guys to share this kind of a data with families. Next slide.
Very, very helpful data.
So this basically just share with you another study, which is a 2,929 patient required invasive ventilation, 915, which is 53% died in the hospital, and 48% in another study died in the ICU. So a very high number of patients dying from this infection. And the risk factor, as you can see, say if someone reach out to you, this is for both Hani and Safura, these are the things that you need to look for, which is their age, are they male, and what is happening in the hospital if their oxygen requirement is too high. So you need to look at their age, male, and oxygen requirement. These three will actually guide you that what would be actually the right time to discuss about their advance directive and see what their wishes are. And usually these are the risk factors that means they're in trouble. Next slide. So this is what happened in the nursing home. As you can see, I was initially mentioning nursing home is created itself as a risk factor because of the circumstance, not availability of enough personal protective equipment, not enough education, patients were not isolated. So you can see different location, Minnesota, Rhode Island, New Hampshire, Connecticut. The range is between 61 to 81%. So I think this may also be an area for both of you, Hani and Safura, to look into and talk to the families for their loved one in the nursing home and talk to them about the advance directive. And because we see these patients coming back and forth from the nursing home with or without COVID infection. So very vulnerable, and I think we have to respect their wishes, and also we need to provide the best possible care for them, and be just comforting for the patient. So next slide. So, what do we take home is if you are in the community or a healthcare provider, so you need to avoid any crowded places, wear a face mask, social distancing, which is 6 feet, hand washing, cleanliness. As I mentioned, the surfaces are impacted. Wood, metal, plastic, 72 hours, the virus can live or longer. And then once the vaccine arrives, then if we have enough vaccine availability, then people impacted, the first responder and people high risk should get the vaccine. When do you get help? When you need hospital admission is you're short of breath, dyspneic oxygen requirement. And at some point, we have to decide if you're going to need Decadron and remdesivir. And what's happening in Europe right now is in Spain and UK, their ICU beds are full. UK and French Prime Minister, they put a lockdown midnight. I think it's 10 p.m. or midnight till 7 a.m. For now because of these issues, and limit the number of gatherings to less than 6. And we just have to get ready for the second wave and see what we have to do to protect ourselves. So I think to take home message for you guys, Hani and Safura, is to work with the people who are getting admitted to the wards and see if we can work on their advanced directive, and also nursing home population. So I really want to thank you all for joining and taking the time out and for your attention. Thank you so much.
No, thank all of you. This was like one of our best webinars so far, and really all your experience and knowledge really helped a lot. And Hani, would you like to talk about some advanced healthcare directives before we go?
Hey, bro, can you give me please access just to my PowerPoint real quick? Because I think you took that power from me. I was able to. I'm just be able to share my screen, which got access to it. Okay, so Jazakallah khair, Dr. Imran. So in light of COVID-19, I'm going to briefly talk about some of the provisions that we are putting together. We actually had to revamp our whole, the whole advanced healthcare directives that we had in place originally due to COVID-19, because, there are a few unique circumstances that, you need to be aware when you draft these documents to ensure that, that you're taking care of all the potential scenarios related to this coronavirus and in the treatments that are properly addressed. So I'm going to offer several more provisions, but these are the most important ones that we have that you should consider adding to your directives to ensure that basically the documents address as many potential contingencies as possible during this ongoing pandemic. So there's gonna be, most likely with the advanced healthcare directives that you have already, there's a lot of conflicting information with whatever we are gonna add, just to specifically be able to plan for COVID-19. So we put in, and these are, I'm gonna share with our attendees this slide, so they make sure that they can get it updated as soon as possible. Obviously, Spore and I, we can help them set up their advanced healthcare directive. But if you have one too, just make sure you are, kind of using or discussing with your professional these provisions to hopefully they can give you their opinion on it and start. So first of all, you want to start with notwithstanding any directions, instructions, wishes, choices, or intentions expressed to the contrary elsewhere in my advanced healthcare directives, you want to mention that if I exhibit any symptoms that suggest that I may be afflicted with COVID-19, I wish to be tested for such virus and consent to any means of testing that are available. If I'm diagnosed with COVID-19, I consent to being quarantined in a hospital. However, I prefer to be quarantined in my home if at all possible. I consent to my agent being able to visit me in any possible way and communicate with me by whatever means possible during any period of quarantine due to COVID-19. As Dr. Sena mentioned, we're not gonna, if you're a medical agent for a patient with COVID-19, you're not gonna be able to visit them in the hospital. So you wanna have access to it, be able to make these decisions through your phone, through FaceTime, whatever means that are available to be able to communicate that the patient has an advanced healthcare directives. And you want to mention that I wish to remain in contact with the above described individuals to the extent possible. So if intubation or artificial ventilation or any other medical aids or devices may aid me while diagnosed with COVID-19, I expressly wish and consent to the administration of those aids. Because again, and we see so many advanced healthcare directives, they don't have this because, the norm is that, if I'm gone, I'm gone. I don't want to be put in any type of an artificial means, but not for COVID-19. So you just want to make sure that you expressly state that you want to be put on any artificial ventilations and any end of life decisions that I have previously made, indicating you wish to withhold life-sustaining measures do not apply while I'm afflicted or diagnosed with COVID-19. And I intend to be kept alive by all means possible if I'm afflicted or diagnosed with COVID-19. As Dr. Imran mentioned, you know, there is a recovery even after you've been, so you just want to make sure you put in these documents. And I'm gonna just add a few more to expressly consent to any medication that may help you recover from COVID-19, including any medication that is considered experimental. I give my agent authority to sign all documentations, including waivers, indemnifications agreements, and hold harmless agreements that may be required for me to receive some medication, because a lot of doctors, a lot of hospitals are worried to be sued at this time. So these are a lot of new updates that they have to deal with as well. So you just want to make sure that you are releasing them as well from any liability. In the last few points, I consent to participate in any trials being conducted for treatment of COVID-19 and give my agent the authority to sign any documentation regarding such trial. I give consent for my agent to communicate with all healthcare providers in person, by phone, by video, or other electronic communication, and to send, receive, and view any documents or healthcare information electronically, because you're not going to have that luxury of being or meeting with them in person. And the last one, if there is any conflict between these provisions and any other provisions in my advanced healthcare directives, these provisions will apply. And this is just some of the provisions that you should, and we have more, but I just chose 8 of the most important ones. And inshallah, we can help with anything.
Yeah, Hani, you know, this one is really important in terms of communicating, allowing your data to be utilized by doctors and by scientists, because ultimately, as you know, as Dr. Imran was pointing out, we don't know the long-term consequences of a lot of this. And the way that we are going to figure out the long-term consequences with the data that we have, right? So, Allah protect us all, inshallah, and protect you. But so whoever gets COVID-19 really should allow that data to be utilized by the scientific community to get better understand short-term, mid-term, and long-term consequences of this, so we can address it better. So thank you. That's a very important actually add-on that you've done in the advanced healthcare directive.
Yeah, and due to COVID-19, Sephora and I, we had to kind of invest in a digital estate planning software to be able to help our patients. God forbid, you know, they need the advanced healthcare directives. They can basically access it online on the cloud. It's stored somewhere on the cloud where all they need is a username, password. Not only it has their advanced healthcare directives, but it's a portal that includes all their financial assets to help their family you know, just get more financially organized than ever before. There's $8 billion in the State Department of unclaimed property in California alone, and $58 billion nationwide. So if somebody, God forbid, is incapacitated or in the middle of a COVID-19, you want to make sure that the rest of the family know of their other financial assets. And this is somewhere where you can keep all your assets, very secure platform portal that the same used by banks as well. So
all your legal documents, including healthcare directives, and then also all the necessary HIPAA waivers that come with, you know, assigning an agent and then having them, you know, be able to access all your information. And then, you know, it's really good to also plan your agents in advance when, you know, someone you trust and not someone that would get appointed as your point person that maybe you wouldn't want.
Absolutely.
Is this web-based, or is this something that you guys are hosting, or is this something new?
This is something new, actually. This is a proprietary, basically, system that has even AI and you know, features in it that suggest some of the gaps that you have in your financial plans and in your legal documents as well. So inshallah, we are introducing it to our community, part of our services as well.
So it'll actually tell me if I'm missing something that I should have. It actually will automatically pop out and tell me that.
Absolutely.
It'll organize your assets, your insurance, your retirement, your taxes, you know.
Yeah, once you put all
So Hani, do you have to sign up for this particular software with you guys? And then once you
Yes.
sign up, then you have to merge all your document in this software, like 401k. So you have to put all those documents yourself, right? This is how it will work, or
Yes.
and then it will just, once it's all organized, then it will be available to you, your lawyer, or the healthcare professional.
It'll be accessible from anywhere as long as you have internet and your username password.
So what are you saying? So let's just say if I buy a house and I don't have, for some reason, I don't have insurance on it, it'll kind of pop up and tell me that, hey, you're missing insurance on this house.
Absolutely. That's one
Yeah,
of the,
the AI, yeah, the AI.
Okay.
because it has like some kind of basically an AI. And this is really, you know, something that is, and they suggest any of the gaps to make sure that you have these gaps covered.
Okay.
And at the end of, after you put in all the information, there is a summary of all the suggestions that the system suggests that you have to have in place.
So let's just say that and not that Sapor and I aren't planning on a new baby, but Allah knows best. If it's not, I'm making an example. If a new child is born, I mean, it's like with Kobe Bryant. You know, when he died, his youngest daughter, was not part of his trust because he hadn't updated it in the past year, and she was 9 months old when he died. So are you saying that this software potentially, like when you add a new child, it'll tell you, hey, you haven't added this kid to the trust plan, or is I mean, this is very important to me, right? Because I mean, we just had the you know, what's his name, Bozeman, who died recently, and he didn't have a will in place. So, but what's important is that, okay, this is, I mean, actually, I'm going to take a little bit of time on this just because I think it's important for me to understand. This kind of keeps an eye on what I need and kind of gives me pop-ups to say, hey, this should be done, this should be done. Or you have a house and you don't have insurance enough to cover in case something happens to me paying off that house. It'll tell me that.
Yes, all of that, and it keeps all your assets organized and your accounts, your business interests, your brokerage accounts, bank accounts, also any liabilities, debts, credit cards. So everything's organized into one platform that's easy to access, and also your legal documents, even with our wills and trusts, it just really illustrates the whole structure for you. There's another back end side to this. These are some of the things, some of the features, but it has even, like if you see in the top right hand corner, it says more features. There's a lot more to this, and it also allows you to leave legacy photos, videos, you know, all of that too.
But
I
it
think
has,
this is a great. I think this is a great software and great use of AI. That's excellent.
so to answer your question, Dr. Sana, at the end, after you input all your financial assets, you put all your legal documents, your insurance policies, it will give you a summary of the suggestions that the AI itself would basically have you to identify some of the gaps that you might have for you to review. And then you make your decision after you review this document that prints out basically, and you get an email copy to it. You make a decision, do I want to get that in place, take care of it or not?
So it's a crazy question, but would it tell me if I'm underinsured for something?
Absolutely, yeah. No, it's actually one of the, it has a life insurance human evaluation test. So basically it tells you, and it takes, so let's say you have a $2 million home or $1 million home and you're the only breadwinner of the family, right? And something happens to you. Well, what happens in this case? If, for example, if you don't have a life insurance, right? Or you have your life insurance at 500,000 and you still own $1.5 million on it, it's going to tell you, well, potentially if something happens to you, then this home could potentially go into foreclosure, because guess what? If it goes into probate, if you don't have a plan put in place, then you're not going to be able to pay that mortgage and it ends up in probate. So these are some of the features that this is, I mean, the main reason why we invested in that.
Okay, that's great. Thank you. Good to know.
Yeah, I just wanted to thank all the panelists, and I really enjoyed this session, and I really hope that, you know, you guys will visit us again and provide us with more information in the future.
No, thank you for having me. That's really good. And Talia, Dr. Imran, honestly, really, again, thank you so much. We did this, what, 3-4 weeks ago with the Turkish government and the Turkish people, and they blasted it everywhere. Just so you know, for FYI, this is actually has been recorded and it's going to go around in Pakistan as well. So Just so
Yeah,
you know.
I think, I want to thank Hani, Safuraz, Dr. Sana Khan, and Dr. Atalia for getting this thing all organized. One thing I would mention is this COVID-19 issue that you have pointed out in your advanced directive, getting testing, getting authorization. I think that is so critical and so important. We face it every single day. Sometimes I can't find the family, I can't find any loved one that I can get an authorization to give them an experimental medication. So this is so important right now. I think this needs to be addressed again and again and again. And the more you teach your community, your clients, I think we are better off because we can provide better care for the patient if we can get an instant answer rather than me waiting for someone, some uncle from Kansas. We find it and they call us after like 8 hours, and we already talked about the cytokine storm. And if you lost that window, we really don't want that. We want to take care of a patient instantly, and this is the time that you guys come into play.
Every moment matters at that time. Yeah.
Absolutely.
I agree with that. We've had patients whose family we couldn't relocate, and we have a trial. And just to sign that consent, if they have relatives only in Mexico, Spanish speaking, and we reach out to them, but it sometimes takes days. So, yeah.
And it's not just Talia, this is probably not just with COVID, right? I mean, it's probably you can even see this. Of course, people having heart attacks or strokes and things like that. If they don't have an advanced directive in place, and so Dr. Imran, you want to, if you as a doctor want to give them the most advanced possible care, but maybe in the experiment, you really want to have that right to do it, but you can't unless it's in written format with the directive.
Agree.
So, yeah, that's very, very important. Okay, well, thank you so much. Really, I actually learned a lot from. I always learn from the two of you anyway, as it is. But alhamdulillah, having to change the slides for you today made me actually even more focused. So, but it's not a permanent job. I don't want to take it on.
But I think you do a great job with the slides.
That was awesome. Thank you so much.
Thank you so much.
For everyone attending.
Thank you.
And all the attendees, alhamdulillah. Jazakallah, inshallah. We'll see you guys
Thank
next
you.
time. Assalamu alaikum.
Sounds like it.
I wanna wake up in the morning with the sun, wear a smile, go out and have some fun. Gonna take away the worries on my mind, oh, put them on one side. 'Cause every day is like a brand new story with unwritten lines. And no matter the weather, it's gonna be alright. I know my life ain't perfect, but I don't have to worry, 'cause I've got all that I need right here in my life. I know my life ain't perfect, but I like the way it's going, 'cause I've got all that I need right here in my life. Thank you for the good life, good life. Allah, I wanna thank you for the good life. I leave it all in your hands, oh. Thank you for the good life, good life. Allah, I wanna thank you for the good life. Hey, listen, there are things in life that money just can't buy. Happiness and love don't have a price. All the people that surround me every day, oh, I just appreciate. I love living in a brand new story with unwritten lines. And no matter the weather, it's gonna be alright. I know my life ain't perfect, but I don't have to worry, 'cause I've got all that I need right here in my life. I know my life ain't perfect, but I like the way it's going, 'cause I've got all that I need right here in my life. Thank you for the good life. It's about being thankful and trying to understand that the more I learn, I wanna leave it all in your hand. Cause I know he'll always take good care of me. You've given me a good life each day. Yeah. Good life, oh, good life. Allah, I wanna thank you for the good life. Yes, I want to thank you, oh Allah. Thank you for the good life, good life. Allah, I wanna thank you for the good life. I leave it all in your hands. I know my life ain't perfect, but I don't have to worry, 'cause I've got all that I need right here in my life. I know my life ain't perfect, but I like the way it's going, 'cause I've got all that I need right here in my life. Thank you for the good life, good life. Allah, I wanna thank you for the good life. I leave it all in your hands, oh. Good life, good life. Allah, I wanna thank you for the good life. I leave it all in your hands, oh. Thank you for the good life, good life. Allah, I wanna thank you for the good life.